We are excited to welcome to the show this morning Dr. Lynn Madden, who is the president and CEO of the Apt Foundation. And you've probably heard actually some of the commercials that we've been running for the Apt Foundation, but I want to reintroduce what it is that they do. And so, Dr. Madden, thank you so much for being here. How are you?
Good morning. Thank you, Melissa. I'm really happy to be here. Thank you.
Yeah. So first of all, for people who may not be familiar, let's start there. What is the Apt Foundation?
Apt Foundation is an organization that provides treatment for substance use disorders and mental health care. We've been around for more than 50 years. Originally founded by members of the Yale School of Medicine Department of Psychiatry. And today we're really well known for providing accessible treatment, particularly for drug use disorders. And we focus on opioid use disorder. We have created a model that allows us to provide same-day access to medications for people who can just walk into the organization.
Wow. I think that's such a big deal. And I mean, this is a little off the cuff, but I'd love to get your professional insight on this, Dr. Madden. But has it been a lot busier for you guys in recent years? I mean, I know just from a news standpoint, we obviously had the opioid crisis, but we've also been seeing, unfortunately, a lot of more traffic drugs, fentanyl, what have you. Mm-hmm. Has it been exceedingly busy for you guys in recent years, would you say?
I think that's an excellent question. And we started this open access model that we're currently running at the Apt Foundation. We started walking through that in 2007. So we really have welcomed everyone, regardless of ability to pay, for a very long time. What we are seeing, and directly to your question, is much more involvement of fentanyl and other kinds of drugs like xylazine among the persons who are choosing to walk in for treatment. So there's definitely a large fentanyl issue, and it's a growing issue in our country and in this state.
Yeah, but that's why entities like the Apt Foundation are so important. And right now, the Apt Foundation is launching what's called Let's Break Barriers to Treatment. This is a new campaign. Talk to us a little bit about it.
Yeah, I mean, our model is really rooted in both dignity and respect, but also in urgency. So one of the big things that really kills people, if you will, we still have a giant overdose problem in the U.S. More than 220 people a day die of drug overdoses. We're pretty fortunate here in Connecticut. That seems to be trending down a little bit, which is excellent. But part of the reason that people don't get the care that they need is that there are barriers to treatment, right? Like waiting time or lack of access to local treatment organizations. And there's also stigma about not only drug use, but also some of the treatments that we have for drug use disorder. Yes.
I mean, again, from a standpoint of what, especially in the last year or two, when it became more accessible to have Narcan, the amount of pushback there even was to make that something readily accessible in your pharmacies was, if we make this available, well, then that's going to encourage people to use drug use more. And I said, no, not necessarily, actually. If anything, it's kind of being proactive, right? I mean, the goal here is to save lives. And so Absolutely. Narcan is it's just an example again, but you're right. There is such a stigma around it.
Yeah. I mean, less than about 20% of people who need treatment for an opioid use disorder actually receive it. And so what that means is 80% don't.
Yeah,
and that's the most positive number that we come up with. There are people who estimate that it's really only about 12% of people who receive the care that they need.
Wow.
Right? So I think the distribution of Narcan is an excellent example of, people just trying to walk through breaking barriers to stigma. And kind of the next level for that is really getting people into evidence-based treatment. And the only known evidence-based treatment for opioid use disorder is actually medication for opioid use.
Wow.
Right? I mean, this is the real hill to climb, right? Because we don't culturally like this idea of medications, methadone or buprenorphine. They in themselves are highly stigmatized. But really what we see is fewer than 10% of people who have an opioid use disorder can recover without the use of a medication.
So I guess that's a really big challenge then, Dr. Madden. I think you outlined that so perfectly, because when you look at about 10% of people who can actually overcome an opioid addiction without using medication, that's a substantial amount of people who don't. essentially. So how do you get that kind of a message out there? I mean, you're dealing with a crisis of abusing drugs, essentially, but we're asking for medication to maybe be the solution for it. How do you strike that balance? That's tough.
Yeah, I think so much of it is really about campaigns like this and conversations like this, right? We have to help people understand that while this may not be a perfect solution, it's the only solution that we have from a science perspective and a medical perspective to really help people not die. And then if you can stay alive, if we can help you enter treatment, early is always better with any chronic condition, right? If you can enter treatment, your likelihood of death goes down from all-cause mortalities for any reason, those issues that might be related to drug use, for example, but also from drug use or overdose itself. So entering treatment helps more people live. And as people live, eventually they begin to thrive in treatment and they do better over time.
Yeah.
Right? But I agree with you entirely. It's a tough hill for folks to climb because we don't really want it to be true.
Right.
Right.
But I think that's why these types of campaigns, the Let's Break Barriers to Treatment campaign, are so important. And I want people to know that if you want more information, certainly from the Apt Foundation, make sure you check out their website, which is Apt, A-P-T, foundation.org. Again, that's aptfoundation.org. And Dr. Lynn Madden, I want to thank you so much for the work that you do as president and CEO of the Apt Foundation. And thank you for sharing all this here on WICC. We appreciate it.
Thank you, Melissa. Take care.
Thank you. You too.